Okay. So you know how sometimes you hear about these like big changes going on, but they feel kind of distant?
Right.
Well, today we're going right into something that could really hit home for a lot of people.
Yeah,
A major overhaul happening within the U.S. health agencies, the
absolutely.
very places that are designed to keep us, safe and healthy.
Exactly. And specifically, we're talking about a significant restructuring going on at the Department of Health and Human Services,
Yeah.
HHS.
HHS.
So, think about that for a second.
Yeah.
When you consider that HHS oversees everything from the safety of our food supply
Right.
through the FDA
Of course.
to tracking and preventing diseases
Yeah.
through the CDC
CDC.
to even managing vital medical research
Oh, yeah.
through the NIH,
Right?
any large-scale changes at HHS
Yeah.
are bound to have a ripple
Oh,
effect
absolutely.
across the country.
It's a huge deal, and that's what we're looking at today.
Yeah.
What's really brought this whole thing into focus is an article from The Guardian, dated April 1st, 2025.
Okay.
And it gives us this snapshot of the very beginning of some pretty substantial workforce reductions
Yeah,
that are now underway
that's right.
at HHS.
So what we want to do today is really cut through any confusion and help everyone understand what's going on.
Yeah.
Look at how big these layoffs could be,
Right.
the reasons behind them
Yeah.
as they're being reported,
Yeah.
and what the immediate impact looks like
Absolutely.
on the ground.
Now, it's important to remember that these events are occurring within the context of the Trump administration,
Right.
with Health Secretary Robert F. Kennedy Jr. playing a central role in leading this whole overhaul.
Yeah, that's a really crucial point.
Yeah.
It immediately gives us a sense
Yeah.
that we're potentially looking at
Yeah.
a significant shift
Yeah.
in how things are run.
Absolutely. So let's dig into this a little bit.
Okay.
The Guardian article starts by placing us right on Tuesday, April 1st, 2025. But it also mentions that the announcement of this big departmental shakeup by Secretary Kennedy
Yeah.
actually came the week before.
Right.
So things are moving fast.
Incredibly quickly.
Yeah.
And it's also worth considering
Yeah.
that the article points to another significant event.
Okay.
Just prior to this,
Okay.
Donald Trump's administration moved to strip collective bargaining rights from workers
Oh, wow.
at HHS and other federal agencies.
I see.
Now, what that essentially means is that the ability of unions to negotiate terms and conditions of employment for
Right.
these federal workers
Yeah.
was weakened,
Okay.
which could potentially make implementing layoffs like these
Right.
more straightforward.
Okay. So that's an important thing to keep in mind.
Right. And then you get to the sheer scale of what we're talking about here.
Yeah.
The article mentions potential staff reductions of up to 10,000 people
10,000 people
at
at
HHS.
That's a lot of people.
It is a staggering number.
Yeah.
To give you a sense of the scale,
Yeah.
the article notes that HHS currently employs around 82,000 people.
Okay.
So a reduction down to 62,000 would mean nearly a quarter of the entire workforce could be affected.
Wow.
That kind of cut
Yeah.
is going to have a real tangible impact on the agency's capacity.
And it's not just about, people naturally retiring or leaving for other jobs.
No.
The article makes it really clear that this situation is different from earlier voluntary buyouts
Right.
that we saw, in the early 2000s.
Yeah.
This involves a combination of actual layoffs,
Yeah.
people being told they no longer have a job,
Right.
as well as early retirement offers.
Yeah, that suggests a much more deliberate and possibly more disruptive approach.
Yeah, it does. And the picture the article paints of the human impact is really striking.
It is.
You have this image of HHS employees
Yeah.
in Washington, D.C. and Maryland lining up for hours
Wow.
outside their federal buildings just to find out if they still have a job.
It's a very visual and, frankly,
Yeah.
quite unsettling scene to imagine.
Yeah.
The detail about an office employee
Yeah.
having to use their security badge
Yeah.
to see if a red or green light came on.
Yeah.
It almost feels like something you'd see in a dystopian movie,
Yeah.
not the reality of people's careers hanging in the balance.
Right. And then you have these personal stories starting to emerge.
Yeah.
The quote from the 20-year HHS employee who mentioned Project 2025
Right.
and said they'd been aware of potential layoffs since February.
That adds a significant layer.
Right.
It suggests that this wasn't a sudden decision,
Yeah.
but something that had been anticipated,
Right.
likely creating months of unease
Yeah.
and speculation
Yeah.
among the employees.
Right. You can imagine the impact that
Yeah.
kind of uncertainty would have
Yeah.
on morale and productivity.
Absolutely. And the supervisor's description of the security line process
Yeah.
is also quite telling.
Yeah.
Comparing it to airport TSA procedures,
Wow.
having to remove shoes,
Yeah.
take out laptops,
Yeah.
and having your badge checked against a list.
Wow.
It paints a picture of a very formal, almost impersonal way of delivering this kind of life-altering news.
Yeah, it does.
You'd hope for a more human approach
Yeah.
in such a sensitive situation.
Right. And the quote from the HHS employee expressing deep concern for vulnerable people and communities
Right.
really brings home the potential consequences
It does.
of these cuts.
Yeah.
Their question about the fairness of the process,
Yeah.
specifically the apparent lack of consideration
Yeah.
for job roles performance and even cost effectiveness,
Absolutely.
really highlights the human cost of such broad strokes.
And the article doesn't shy away from the emotional toll,
Right.
mentioning the employees' tears.
Yeah, that's a powerful image.
It is a stark reminder that these aren't just numbers on a spreadsheet.
Right.
These are individuals with families and careers that are being directly and profoundly affected.
Right.
These are often people who have dedicated years
Yeah.
to public service
Right.
to face this kind of uncertainty.
Yeah.
And potential job loss is undoubtedly incredibly stressful
Yeah.
and demoralizing for them.
Absolutely. So what's the driving force behind this massive shakeup?
Right.
The article mentions Secretary Kennedy's goal to dramatically reshape HHS.
Yeah.
This doesn't sound like just trimming the fat.
No.
It seems to be about a fundamental restructuring
It does.
of the entire department.
That's certainly the impression.
Yeah.
The creation of this new entity,
Yeah.
the Administration for a Healthy America,
Okay.
which is intended to absorb existing agencies that manage addiction services
Right.
and community health centers,
Right.
signals a really significant reorganization
Yeah.
of how these critical public health areas
Yeah.
will be handled in the future.
And the article specifically points to the areas targeted for these job losses.
Right.
Human resources, procurement, finance, and IT.
Right.
It's understandable that these are often seen as support functions.
Yeah.
But anyone who's worked in a large organization knows
Absolutely.
they are absolutely vital.
They really are the essential infrastructure.
Yeah.
While these roles may not be directly involved in conducting scientific research at the NIH or carrying out food safety inspections for the FDA,
Yeah.
efficient HR, procurement, finance, and IT systems
Right.
are absolutely critical for those core functions
Right.
to operate smoothly and
Yeah,
effectively
Yeah, cutting too deeply in these areas
Yeah.
could definitely have knock-on effects.
across the entire department.
Yeah, and the article mentions that there's a prioritization of eliminating jobs
Yeah.
in high-cost regions,
Right.
and those positions deemed redundant or duplicative,
Got it.
according to an internal reduction in force email.
Okay.
That raises some really important questions.
Absolutely.
How exactly are these determinations being made?
Right.
What criteria are being used to decide what constitutes a high-cost region
Yes.
or a redundant role?
Those are precisely the crucial details that are often missing
Yeah.
when these kinds of broad announcements are made
Yeah.
without clear transparency
Yeah.
about the specific metrics and processes used to make these decisions.
Yeah.
It's easy to understand why employees would feel concerned,
Right.
potentially unfairly treated,
Yeah.
and perhaps question the rationale
Yeah.
behind these choices,
Right.
just as that employee in the article did.
Let's talk about the specific impact
Yeah.
on some of these key agencies.
Yeah.
The numbers provided in the article are quite significant.
Yeah, they are.
We're looking at a potential loss of 3,500 positions at the FDA,
Right.
the Food and Drug Administration,
Right.
which, as we mentioned, is responsible for ensuring the safety and efficacy of our food and drugs.
Absolutely.
Then there's a potential reduction of 2,400 positions at the CDC,
Right.
the Centers for Disease Control and Prevention,
That's right.
our primary agency for protecting public health
Right.
and preventing the spread of diseases,
Right.
the National Institutes of Health,
Yeah.
or NIH,
Uh-huh.
the leading body for medical research in the U.S., could see a cut of around 1,200 positions.
Yeah.
And finally, the Centers for Medicare and Medicaid Services, or CMS,
Yeah.
which administers our national health care programs,
Right.
is looking at a potential reduction of 300 positions.
These are all agencies with incredibly important
Yeah,
and distinct mandates.
absolutely. Think about the potential implications here.
Well, with a significant reduction at the FDA,
Yeah,
you might see a slowdown in the process of approving new drugs or medical devices,
right.
or a decrease in the frequency and thoroughness of food safety inspection,
Yeah,
which could have tangible consequences for public health.
that's a scary thought.
Similarly, cuts at the CDC could impact their ability to respond effectively to disease outbreaks
Yeah.
or to conduct crucial public health research.
Right.
The NIH plays a vital role in advancing medical knowledge,
Yeah.
and a reduction in their workforce could potentially slow down the pace of discovery.
Right.
And CMS affects the healthcare access for
Yeah.
millions of Americans. So any significant changes there need careful consideration.
Absolutely.
The anecdote shared in the article
Yeah.
about the former CMS executive Karen Shields
Okay.
and her reaction to a reduction in force notice is particularly striking.
Yeah.
The fact that the notice apparently advised employees with complaints
Uh-huh.
to contact a deceased former director.
Wow.
It really speaks to a lack of attention to detail
Yeah.
and a potential disconnect
Yeah.
within the administration's handling of this process.
And as she points out, it's deeply insensitive.
It's more than just an oversight. It
Yeah.
suggests a potentially chaotic or rushed implementation
Yeah.
of these changes.
Right.
Her emotional response,
Yeah.
I knew this would have broken her heart,
Right.
really underscores the personal impact
Yeah.
and the sense of loss
Yeah.
and perhaps even disrespect being
Yeah.
felt by those who have dedicated their careers
Yeah.
to these agencies.
So as we start to wrap up this initial deep dive into
Yeah.
this developing story. Yeah.
What are the key things that stand out to you?
The main takeaways for you to consider are the sheer scale of the potential workforce reductions at HHS.
Yeah,
We're talking about thousands of dedicated public servants.
right.
This is happening under the direction of the Trump administration
Right.
and Secretary Kennedy
Yeah.
as part of a significant overhaul
Yeah.
of the department.
Yeah.
And these potential cuts are spread across some of the most critical health agencies in the country,
Right.
including the FDA,
Yeah.
CDC,
Uh-huh.
NIH, and CMS.
And it's really hard not to think about the potential long-term consequences
Yeah.
for the crucial public health functions that these agencies perform day in and day out.
Absolutely.
Everything from monitoring and responding to disease outbreaks
Right.
to ensuring the safety of our food and drugs
Right.
to conducting vital medical research.
Yeah.
All of this relies on the expertise and the sheer number of people working within these agencies.
Precisely when you see a reduction of this magnitude in the workforce.
Yeah. There's a very real risk of impacting the agency's capacity to effectively carry out its core missions.
Right. And that's a scary thought.
It raises significant questions for all of us about potential delays in essential services,
Yeah.
a reduced ability to respond to emerging health threats,
Right.
and the overall resilience of our nation's public health infrastructure.
This whole situation certainly gives you a lot to think about.
It does.
What are the broader implications of such a significant restructuring of the nation's health infrastructure?
Right.
What questions does this raise for you
Yeah.
about the future of public health medical research and the social safety net in the U.S.?
Right.
It really encourages you to think critically about the information we've discussed today and perhaps explore further the specific roles and responsibilities
Yeah.
of these affected agencies and what the potential long-term consequences of these kinds of changes
Right.
might be for all of us.
Absolutely.
Thanks for joining me
Thanks for having me.
on this deep dive. Until next time, stay informed
Right.
and stay engaged.
Stay healthy.
Stay healthy. That's a good one.